When does core muscle exercise not work very well? We all know for our spine to be healthy and for us to function well, we need strong core muscles, and we hear it over and over and over. But the answer is core exercise doesn't do that much good if the neurological activation is lost. And by that I mean different stresses or injuries have decreased the firing from the brain to those muscles, and that's lost. And then you can exercise it and exercise it and exercise it, but you're not going to have a stable spine, and you're not going to have the results that you would have otherwise. And case in point, just recently worked with somebody who's a yoga instructor, a fitness instructor, very well has had lots of core exercise, but when you test and just push the resistance, one side is strong and the other side just gives. And the same with checking, for example, them laying on their back and pushing their legs down and pushing their legs into rotation, different things. One side gives, one side gives, one side gives. Even standing, you can torque them and try to straighten them, and one side gives. That's because the neurological activation is lost, and they're not going to get the good out of the core exercise that they would otherwise get. And so what do you do about it? Well, what we do is test it. You have to test the muscles to bring them on display to the brain so the brain recognizes that there's something off there. Then you can supply information that the nervous system can use to reboot itself. And that is red light therapy. And we've covered that in other videos. Red light therapy supplies extra energy for the nervous system to reboot itself, and has in itself exercise-like effect on the nervous system. It's called hormesis. So an exercise-like effect with more ATP, or energy production, for the nervous system. That will allow that almost instantaneously to reboot. And what doesn't reboot with just the red light therapy, we will activate with our adjusting instrument that just taps 12 times a second, and very, very gentle. We'll find the right places that we need to activate with the instrument and reboot the connection between the brain and the muscle. Then when that's firing properly, the person will be able to get all the good that they should out of their core exercise. And so that answers the question, when does core exercise not seem to work? And why isn't it helpful? And why isn't my spine getting balanced when I'm doing all this core work? Well, it's, again, because the neurological activation has been lost. And so if you want somebody to test that for you, we can certainly do it. Winter's Wellness Chiropractic Redefined, it's part of our technique that we use called quantum neurology. And it's very powerful, especially for athletes. 60% of the track and field world and Olympic medalists in the last 10 years have used quantum neurology doctors to help them upregulate their system and be at peak performance. So watch some of our other videos in our quantum neurology playlist. I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined. Subscribe to us here on YouTube and like us on Facebook.